The Children's Eye Foundation of APOS is proud to be partnered with Klick, the world's largest independent health marketing agency, to bring the world's first interactive storybook created to help screen for color deficiency in children. When Klick considered who the right organization was to bring this idea to the world, they felt strongly that CEF of APOS was the ideal partner. They shared, CEF of APOS is doing important work to bring vision equity to children everywhere. With the clinical expertise of their membership, we knew CEF of APOS was the perfect partner. With that, I'd like to introduce our lead consultants, Dr. Rick Whitehead and Dr. Gavin Roberts. Let's learn some more about color deficiency in children.
Thanks, Kristen. Color deficiency is frequently undiagnosed in children, usually because children don't know anything is wrong with their vision. The way they see is the way they've always seen, and that's what they know. This is actually similar to other problems that we frequently see with kids' eyes. Sometimes teachers or parents will attribute color vision issues to laziness or attention-seeking behavior, such as coloring the grass red instead of green, when they're simply just coloring the world the way they see it.
Dr. Roberts, what challenges, shortcomings do you see with the Ishihara test used as a diagnostic tool with children?
Kristen, that's a good question. The most common issue with Ishihara testing in children is availability. It's not in widespread use except in doctors' offices. And sometimes testing can be limited by attention span or attention-seeking behaviors, things along those lines, particularly in younger children.
Dr. Whitehead, what are your overall thoughts on using a fun, interactive storybook like The Curious Eye as a tool that can identify the need to have a child tested for colorblindness?
I'm really excited for the opportunity to use this new storybook, especially in finding kids that previously have been undiagnosed with color deficiency. There are just so many kids that have no idea that color deficiency even exists. And giving caregivers or teachers or even physicians an opportunity to increase the number of kids screened will help us identify more kids that have color deficiency so that they can be shown the way that they see the world. Additionally, there's probably a few adults out there that haven't been diagnosed as well, and this will help to find them. Finally, there's a benefit for everybody that reads the book in understanding that other people may see the world a little bit differently than they do. And I think that'll be helpful for everyone.
Dr. Roberts, how do you think the book can help pediatric ophthalmologists and eye care professionals?
Kristen, I think this book will have an impact in two important ways. One is as a diagnostic tool that's easily approachable in doctors' offices and even outside of doctors' offices as a screening device. And then secondly, it facilitates an education where the conversation may then come up about what color deficiency means, what impact that will have on a person's child, and what to expect in the future.
This is a question for both doctors. Why did you want to be a part of this project? Dr. Whitehead?
I was really excited because I think that this is something that's undiagnosed and frequently just needs kids need a little point in the right direction so that they know that what they're seeing is right, it's okay, and it's all right if their color is a little different than everyone else. I always try to emphasize to patients who are newly diagnosed with color deficiency that while it's important to be aware of, it's not something that is going to cause problems with their life. Both of my brothers have been very successful, one of which is also a physician, and have not had the color deficiency stop them from succeeding at a very high level.
And Dr. Roberts, why did you want to be a part of this project?
Kristen, when I found out that APOS and the Children's Eye Foundation was backing this project, I was very happy to become involved because I am one of those 7 to 8% of males who have a partial red-green deficiency. I wasn't aware of that. I wasn't formally diagnosed until I was in medical school in my early 20s. So I see, like all of us, these children in the office frequently. And I just think it's important to, one, have a diagnostic tool that's user-friendly, and secondly, to communicate to these parents that these children, as Rick said, can go on to achieve levels of success in virtually any profession, any field, despite having a challenge in the sock drawer, picking out the dark red socks from the dark green from the dark brown.
It's been a real pleasure to be involved with this project. Special thanks to the Children's Eye Foundation and APOS and Klick for making this project happen. During the pandemic, we've all had a lot of downtime, and I was really excited to be a part of this project. It's turned out great. I'm so excited to see the finished product and hold that book in my hands, and I'll turn the time back to everyone else here.
We are so grateful to them for their expertise, and also, of course, to our phenomenal partners, Klick Health, who without them, this would not have been possible. Thank you.
As you know, as parents know, and pediatric ophthalmologists know, no child is going to sit down and read an Ishihara test for fun, much like any other test, unless they're have a good reason to do so.
I was excited when I heard about this project. I have always been interested in color deficiency, mostly because I come from a family where color deficiency is part of the way we grew up. There's 4 boys in the family, and 2 of them have color deficiency, and they're my 2 younger brothers. I learned early on that this caused a few problems with how they saw the world. One of which was that when you're playing Monopoly, the money is really easy to switch, and so I have to say I might have cheated a couple times with them when they couldn't tell which money I was using.
Start over.